for your kind words and welcome you all to this August gathering. At the outset, I would like to thank Chitra Madam and the Rotary Clubs for having invited me today to this August gathering and forum where to share my views about the vaccines, especially the corona vaccines. What I would like to do is to speak a little bit about the vaccines, the pitfall, the myths and misgivings, and then I would like to involve more questions from the audience so that it becomes more and more interactive. See, these vaccines have been there since ages. So why this so much of myths and misgivings? We have been taking BCG vaccine, diphtheria, tetanus, now various types of H1B in the pediatric population, and now adult people are receiving pneumococcal vaccines, influenza vaccines regularly. So then when it comes to COVID vaccine, why there is so much of hello ballo and why misgivings and myths and misunderstandings about the vaccine and rather a fear about the vaccine. So with this, I want to clear a few points. Most of the people, they ask me, sir, am I eligible for the vaccine? If you see broadly, everybody is eligible for the vaccination above 18 years of age. Below 18 years, the studies are not done, so we are not aware. But they are trying, studies are going on for pediatric vaccinations as well for COVID. But the government of India, what we have done is because there are certain group of people who are at high risk of getting infected with high amount of mortality. So that's why they have divided the healthcare personnel first, the doctors, the paramedical staff, everything, because they are the first thing who they come in contact with the COVID patients. Once that is over, then people who are more than 60 years or more than 45 years with comorbidities were covered, and now it is open to everybody who is more than 45 years. So there is a lot of, if you hear the news channels, they say, why not open to everyone? Well, it's always ideal that everyone is eligible for the vaccination. But if you see the population of our country and and the amount of vaccines we have right now, so if it is the most prerogative is the healthcare personnel as well as the elderly population and people with comorbidities, because these people are ending up with most of the complications. Young people, even if they get infected, they have a mild infection. So that's the reason why the first priority is given to this group of population with more than 45 years and with comorbidities. The next thing most people ask me is it mandatory to take the vaccine? You must have seen that so many opens have been made for the vaccine, but even in the healthcare personnel, the percentage of people who actually took the vaccine is very less because of the fear of the side effects, the unknown fear of the vaccine, and so many myths are there. So it is not legally, it is not mandatory, but it is always advisable for everyone to take the vaccination because, as I will tell you later on, it prevents the complications of the COVID-19. It may not prevent the infection, but it prevents the deadly complications of the COVID-19. So it is always important to take the vaccination, though it is not mandatory legally. The other doubts people ask is how safe are the vaccines because they have been developed so fast. And I agree that vaccines generally take almost 6, 7, 8 years for all the trials to be done. First, there is a preclinical study where the animals are tested, then phase 1, phase 2, phase 3 of the clinical study on humans, and then it comes into the market for open use. But you must actually appreciate the scientists that seeing the emergency situations in all over the world, scientists have totally collaborated with the drug regulators, and they have, believe me, they have not compromised on the safety and efficacy data of these vaccines, so that we can all rest assured. Why it has been able to come so fast is because the coordination between the scientific community and the drug regulatory authorities have been very fast and tremendous. So that's why the paperwork, all this thing have been hastened up very much, not only in India, but all over the world. So that's the reason why these vaccines have been allowed by the Drug Regulatory Council to be given. So please don't have the misgivings that because the vaccines have been developed so fast, whether they are protective or not. They are very effective and very safe. Then, so once this question comes, people come, sir, I've already had a COVID infection way back in October or November of 2020. So can I take the vaccine? Yes, the answer is yes, because see, once you develop an infection, the antibodies developed in our body due to the natural COVID infection are present. I agree, but they are not that strong nor not that robust, and we don't know how long they will give us the protection. So anybody who is infected by COVID earlier, after 4 to 6 weeks of recovering from the COVID, he should take the vaccine because that will improve his immune status. It will make the development of a robust antibodies to protect against future infections. So the answer is, if you even if you had a previous COVID infection, after a time of 4 to 6 weeks, you are eligible to take a vaccine. Unless you have been having a severe COVID infection, admitted to a hospital, requiring plasma therapy or monoclonal antibodies, then you have to wait up to 90 days, and then you become eligible to take the vaccine. Okay. Then, if the other question which I am frequently asked is, can COVID suspects take the vaccine? So what is a COVID suspect? That is probably if I have some sore throat or cold, or if I have come in contact with a COVID patient in my family, but I have not yet been tested for COVID. So I am a COVID suspect. So the question is, can I take the vaccine? Well, what I would like to say is, if you are COVID suspect, just wait, get it tested first. Because if you are positive, number one, you will not only infect the persons who are sitting in the vaccination room because you are a COVID positive patient. Secondly, if you are already a COVID positive, then you should wait till your infection resolves, and after 4 to 6 weeks take the vaccine. So if you are a COVID suspect, then please wait till you do the test, and then you can, if you are negative, you can go ahead with the vaccination. Then the biggest question which used to come earlier, now it is reduced, is which vaccine to take. Before the data from the Covaxin came, a lot of tension was there, lot of doubts, mates, which one to take. So now I can confidently say that we have two vaccines as of now in India: the Covishield by the AstraZeneca, which is a vector vaccine, and the Covaxin by the Bharat Biotech, which is an inactivated vaccine. Both are equally effective, both are equally efficacious and safe. So whichever is available in your center, please go ahead and get vaccinated. There is no difference between the two vaccines. The other things patient get worried is, can I develop COVID symptoms after I take a vaccine? Well, it is not like that, because we are not injecting a live virus in the body. Okay, so the vaccine, the guidelines say once you complete 2 doses of vaccine, and then after waiting 2 weeks after the second dose, that is first dose, then 28 or days or 6 weeks as per the guidelines, second dose 15 days after the second dose. Okay, so then you develop a robust immunity. So if you happen to get infected before that, then you can't blame the vaccine. See, many people, what they are doing now is, you take 1 dose of the vaccine, and then they are thinking everything is now fine, I can roam about and do whatever I want. Then they're getting infected, then they're blaming the vaccine. But it's not like that. There are 2 doses of vaccine, 15 days after the second dose, then you develop a robust immunity. So let that be very, very clearly understood, that we are not protected with a single dose of the vaccine. You have to wait for the time. And then there is a doubt about this Covishield or Covaxin. See, Covishield is a vector vaccine and Covaxin is an inactivated vaccine. Briefly, I will tell you what is meant by vector vaccine. What is the basic principle behind vaccination? A vector is basically a carrier. Say this is a vector. There is a protein which causes the COVID virus infection. That the spike protein is engulfed in that, and that vector is injected into us. What does this vector do? This vector is a harmless virus, like adenovirus we have in the Covishield virus vaccine. This vaccine, after entering, this vector will generate information. It will instruct the human cells to produce certain proteins which exactly mimic the spike protein of the real coronavirus. So this protein which is developed by the vector in our body is not a real COVID protein. It is just a mimicking that. So once this is developed by the human cells, our immune cells, they recognize that this is a foreign body in the cells, and they will try to attack against this protein. So thereby, future when we get any real COVID infection, they will be ready to attack the spike protein and thereby preventing the complications. In summary, without making it more complicated, the vaccines are given to stimulate the immune cells in our body to produce robust and antibodies, which are fit enough and to fight against any future infections coming, because they have a good amount of memory to fight against the COVID infections in future. And some people, they think that if I take a vaccine, will my RT-PCR come positive? How can it come positive? Because we are not injecting live virus. So rest assured, an RT-PCR will not come positive. We are injecting only the vaccine to give antibodies. So you are not going to develop active COVID infection after the vaccine. Some people say, well, why should I take vaccine? Because none of the vaccine is 100% protective. So why should I take? Tell me which vaccine is 100% protective. We have taken influenza, pneumococcal, BCG, diphtheria. Still people get influenza. Still people get pneumonia. Every vaccine, no vaccine is 100% effective. Every vaccine effectivity varies from 75% to 95%, depending on the which vaccine you are using, what is the recipient's age, any comorbidities recipient is having, the recipient's own immune status. So these are the factors which affect the vaccine efficacy. So none of vaccines are 100% safe. Then lastly, I would like to add that many people think that, as I said, once they take the vaccine, they can go to parties and do everything they want. That's why we are getting this second wave. The three golden rules of COVID associated behavior: mask is very, very important, social distancing, 6 feet, and hand washing. These have to be followed even after completing all the doses of the vaccine. I agree that by taking the vaccination, our immunity levels are elevated in 15 days after the second vaccine, and so we are able to fight the infection. But please don't miss these three golden rules, even though you are totally vaccinated. These golden rules are going to continue till 2022, till all of us develop a good amount of herd immunity. By herd immunity, I mean at least 65 to 70% of the population should be vaccinated or infected and develop the antibodies. So with this brief introduction about the vaccine and its myths and misgivings, I would like to the audience to please clear their doubt, come up with your questions so that we can clear the myths and misgivings. Thank you so much.
Thank you, Mr. Waghray. I would like to request Rotarian Venkat Sunkavali Garu, President of Greater Hyderabad, to moderate the question and answer session. Over to you, Venkat Garu.
Thanks a lot, President Anita. So, one of the questions is that there are several, I think, couple of variants in the COVID right now, and why can't we have one kind of vaccine for all the variants? Is a question from Rotarian Lata.
See, all these vaccines, it's a very commonly faced question, sir, now that we're getting the UK variant, the Brazil variant. So are the vaccines effective? They are effective because most of these, all the vaccines for that matter, both the vaccines what we have at the moment, they produce enough number of antibodies to different parts of the virus, including the spike protein. So whichever type of variant is there, the spike protein and other parts of the virus body is also affected by the antibodies developed, which are the T cells and the B cells. These are the T and the B lymphocytes which are developed in a robust manner. So even though we are exposed to a variant, the protection is still there with the vaccines. Now, whether it is 95% or 85%, we still don't know. But it is better than not taking anything. That's why I said the vaccine plus the mask, social distancing is important to prevent and getting infected. So rest assured that even the variants, if they infect us, we are going to be protected with vaccinations.
Sure. The other question that they have is, we commonly ask to, cover your face with protects you from the nose and the mouth, right? So do we have to? I think there's a, I think new circular that says that you have to, if you have conjunctivitis and other things are also symptoms of the second variant. So should we? Is it coming through nose and ears and eyes as well?
So the route of transmission, if I have a COVID infection, if I sneeze, if I cough, if I talk, the highest level amount of virus is liberated once I'm coughing with a force. Next, if I am sneezing. Third, if I am talking. So these are the three common ways. of infecting others with infection. Now, having said that, I can get infected or anybody can get infected if I touch a surface which has coronavirus on it, and if I accidentally touch my eyes or the nose, then I am going to infect myself, because the nose, through it enters the throat, and through the eyes, because of mucosa, it can enter the inside the body. So that's why we are asking to wash the hands. But the protection by a mask is ideal. If you cover the nose and mouth, this is the common area where we spread the virus. So I hope I'm able to
Yes, I
clear
think
that
that
out.
that's pretty clear that washing hands can is more safer than trying to protect your eyes and ears from that. So somebody who has COVID, can they donate plasma after vaccination? So sorry, the question was, can somebody donate plasma after vaccination?
Yes. See, plasma donor, the requirements are you should have adequate amounts of antibodies. Okay. There's a certain figure, 12 to 18 to 20, depending on what dose of plasma the patient is getting. So once a donor has sufficient antibodies, whether it is due to a COVID infection or whether it is post-vaccination that he has developed antibodies, if your plasma shows that you have adequate amounts of immunoglobulin G antibodies, then yes, you can donate to a COVID patient as a plasma donor.
So can you explain something about the European clotting that's been coming up in the news?
Yeah, there is a lot of questions and doubts about COVID. It's nice that you brought up the question here. There are reports in these clotting has been seen reported in young women, mostly in the European countries. And they have found that this occurs about 2 in 1 million is the ratio, they say. And they say that this is a condition medically what we call as microangiopathic thrombocytopenia. By what it means is their platelet counts are reduced and they go into thrombosis, and then they are presenting with either a severe headache or even blindness or a cardiac issue or any such problem. But they are very, very rare. Now, whether they are related to the vaccine or whether these people had earlier platelet disorders and taken the vaccine, we don't know. But as of now, their direct correlation to vaccine is not established. And in our country, luckily, we have not found any such significant amount of cases so far. But yes, young women in European continents have been about I think 8 or 12 reports have come right now, where they have demonstrated this thrombocytopenic thrombosis, that is a less amount of platelets and then resulting in blood clotting.
Thank
So,
you.
if a patient, a young woman is complaining of severe headache after a vaccination or any difficulty in vision or any chest pain, then you should evaluate her blood parameters like platelet count, CRP, other things, and then admit her and take the treatment. But that is very, very rare. They said 2 in 1 million.
Sure. The other question is, how long will these antibodies show itself in our body?
It has been found, sir, that the antibodies generated by a natural infection are much inferior than those antibodies generated by a vaccine. So definitely a robust immune system, immune cells are generated by the vaccines because they stimulate the B lymphocytes and also the T lymphocytes, which are called as the memory cells. These T lymphocytes, which are generated due to the vaccine, they develop a memory to the spike protein of the COVID-19. So in case we get infected later on, they are ready to fight and kill the virus. Now, having said that, how long will the immunity last? Nobody knows. It's a new virus. Probably we may have to repeat a single booster shot after 6 months, 8 months, or 1 year, like we do in the other flu vaccines. We don't know. But they say the amount of robust antibodies is enough to protect you for at least 6 months as of now. So trials are on. We may have to take a booster shot after 6 months or maybe 1 year.
So the other question is, do we have to stop the blood thinners, I think, getting the vaccine?
I think initially when we used to take advise the vaccination, we were ourselves telling the patients to stop the blood thinners for about 2 to 3 days before and then go for the vaccine. But now enough data has come from the ICMR and other cities that you need not stop the blood thinners. Having said that, if you are on aspirin, the ecosprin, which most of them take for the diabetes and other conditions, you can actually take it. Because the reason why they were telling is once you inject in injection, and if you are on blood thinners, you are likely to bleed here, resulting in a hematoma. That was the reason. So aspirin, they said, is no contraindication, you can take. But if you are taking other blood thinners like anticoagulants for some other condition where you have a bleeding disorder, then yes, it has to be stopped for at least 48 hours to be on the safe side, and then restart it after 48 hours after the vaccination. But theoretically, technically, they are telling that there is absolute no contraindication. You can take both the blood thinners and then the vaccine as well. But what we advise is to avoid this local bleeding. We say at least stop it 48 hours before and then after the vaccination.
And there's been a rumor that J&J vaccine is having a clinical trials on the teenagers. So can you throw some light?
Yeah, J&J vaccine is one advantage is it has a single shot vaccine, and so that is, they say it is only one shot and then you are immune. But the immunity is to the tune of 66.6% with J&J vaccine, 91 to 92% with Moderna and Pfizer vaccine, and 70 to 72% with the Covishield, and about 80% with Covaxin. So that's where the Johnson & Johnson stands as of now. The advantage is it is a single shot vaccine. In Covishield, there are doing trials now where they are telling if the first dose is given at a lesser dose than the actual dose given now, and then the second dose is delayed by 6 weeks. That's why the new guidelines have come now. So there the immunity increases to more than 80-85%. So that's why the government has now postponed the second dose of Covishield to 6 weeks, because to increase the immunity of the person.
Thank you. And obviously the question is about the lungs, like so patients recovering from COVID, right? Will it have a long-term or permanent damage to the lungs?
Sir, COVID, we are seeing now when the COVID started in March and April, now after so many months, we still see patients coming with post-COVID sequelae. By this, I mean patients are developing lung fibrosis, where the lungs get tightened. They don't take part in the lungs. They don't expand freely. They become stiff. And then, so the oxygen diffusion is low in these stiff lungs. That is called as fibrosis. So most of these patients are dependent on oxygen for months together after recovering from the COVID infection. So post-COVID pulmonary fibrosis is one common thing which we see as a pulmonologist. Other conditions also are seen, which are called as long haulers. Patients recover, even mild to moderate COVID, they are recovered, but they complain of weakness for a long time. Just body weakness. There is no specific treatment for it. We all give vitamins, but it takes its own time and goes. Some people, they complain of loss of memory momentarily. Some people, they complain of just recurrent headaches. But these are all the long haulers of the COVID infection. They don't require any specific treatment. We don't know how long it is going to last, but some people recover in 3 months. Some people are continuing till 4 to 5 months. A short word here, what they said, and I want to stress here is who is going into COVID, post-COVID fibrosis, because that's the most dangerous complication what we are encountering. People who are getting admitted later during the course of COVID infection. See, if you develop a COVID infection, we do certain blood markers, CRP, D-dimer, etc. And if these markers are high, we are admitting them in the hospital. And if their oxygen is also low, we are admitting in the hospital. The most patients, they come late to the hospital with a very high values of ferritin and D-dimer. So the higher the values of ferritin prior to admission makes these patients more risky of developing post-COVID fibrosis complication. So that's what we have learned in the last 1 year. So we are concentrating more on those patients who have the high parameters and admit them early and start the aggressive treatment to prevent this complication of fibrosis.
Thank you. So we've been looking forward for the flattening of the curve, right? So now that suddenly we see a steep hike in the volume of the cases we had. So when we do see this flattening of curve?
See, we had controlled it very well by October. If you remember, I think it was October middle or so. Suddenly it started rising. It was our own fault because we never respected the COVID behavior. Elections were held, rallies were held, functions were held, marriages were held, where hundreds of people are coming without mask, going shopping, malls, everywhere. So I think so. The virus again had a place to stay. Again, it has found a home, and though because of this, what do I say? Fatigue of the COVID behavior. I think not wearing mask, not maintaining distance. And so this has resulted in the upsurge of the virus again. There are some theories that the variants must have been increased, but I don't think so. Even the statistics, if you see the epidemiologists of India, they say it is again due to the people not following the guidelines that there is a surge in this virus. The other thing I want to add here is this second surge, what we are seeing now. Most people initially told that it is a mild infection and it will go away by itself. But it's not like that. Probably the people, the younger people who were going out and enjoying in the outside, probably they got infected. They were mildly infected, but once they start infecting the elderly people at home, or people, their parents, or anybody with comorbidities, then these are the group of people who are again ending up in complications. Again, we are back to May, June, what we had in May of 2020. There are no beds in the hospital available right now. So we are again going back to same. So I think that's why I said, even though you are vaccinated or not, please follow the 3 golden rules to prevent this second surge.
Definitely. So I think the other question is that what is the antibodies count that is required after 14 days of the second vaccination?
There was initially, we all used to check the IgG antibody levels after the vaccination. I myself got it checked. But now they say that it has no relevance. You need not check the antibody of IgG to know whether you have developed antibodies or not. If at all you want to check, you can check the spike protein antibodies, which are now available in few of the labs. But practically, if you see, theoretically, you can check the spike protein antibodies and see, yes, I developed the antibodies. But practically, they say it's not required. If you are adequately vaccinated, completed 2 doses, completed 2 weeks after the second dose, you are enough protected already. So there is no need to do any blood test to check for that.
Got it. Yeah. Okay. We have a youngest Rotarian, Dr. Rajay, is 86 years old, and he had a bypass surgery about a decade back. And his question is, his cardiologist and pulmonologist both are recommending to take vaccines. What do you suggest?
100% he should take, sir, because as I told you, the complications of COVID are more in those patients who are having associated comorbidities like diabetes, hypertension, chronic lung disease, chronic heart disease, kidney disease, liver disease, any of these chronic conditions. So the bypass surgery itself is a cardiac condition. So you are at a higher risk of developing complications if you develop COVID infection. And by taking a vaccine, you are definitely going to prevent the complications of COVID infection. You may get infected from COVID in spite of the vaccine. Doesn't matter. It will be a very mild infection. But the complications will 100% be protected. So my advice is, yes, sir, please go ahead and take the vaccination, whichever vaccine is available.
It's a policy question again, when we are short of vaccine in our own country, why do we export vaccines?
I think we are living in a world of, the world is one family as of now. So we have enough vaccine stocks with us, it seems. It's not that we are falling short of the vaccines. So we have to take care of the other people as well. So I don't think that we are compromising on our vaccine stocks and then giving to others. For example, even now enough vaccines are lying there. People are not going to take it. There are still many people, because of misgivings, they are not taking the vaccine. Many vaccines are still lying waste there, waiting for the people to come and get vaccinated.
Sure. And there's a question that says, the role of T cells, and a question on T cells in human body and its relation towards COVID-19.
Very important question and very nice question, I'll say. Because the T cells and B cells, see, if you go to the molecular levels of immunity, our body has immune cells like the innate immunity and adaptive immunity. The innate immunity is what we have immunity inbuilt in us, which is comprises of the neutrophils, macrophages, dendritic cells, killer T cells, etc. And the antibodies which are made by the vaccines, they come under the adaptive immunity. This is in baseline. So the T cells are important because they develop the memory. B cells produce antibodies in response to the infection. T cells develop the memory in response to the infection, so that in future also, if you get a COVID infection, these T cells, by virtue of developing the memory, they can attack and prevent a serious complication of the COVID infection. That's the relevance of the T cells. T cells, other importance is it is called as a killer T cells. So if a cell is infected with a virus and it is circulating, so this T cell will attack the cell and kill it. The virus infected cell is killed by the T cells. That is called as the killer T cells. There are different types of T cells. I don't want to go into the details, but T cells, basically its role is they are memory cells and they act as killer cells which can kill the cell which is engulfed the virus particles. Okay. I hope I have made it clear.
Thank you. The other question is that, why do some of the shots are single, like Johnson & Johnson, and the other ones are, have to be taken twice?
See, it's the nature of the vaccine what you are making. So, as I told you, the vector vaccine and most of the other mRNA vaccines, other things, they have to begin twice. So, it is the nature of the vaccine which is being developed. And the Johnson & Johnson technique is different morphologically and even immunologically. So that's why they're able to make it a single shot. But who knows, in future, even our Covishield is trying for a single shot vaccine. And if you are aware, there is a nasal vaccine also going to come soon, where just like a nasal spray, you spray, it will kill the virus here itself. And now some studies are telling that you can take both nasal vaccine as well as the systemic vaccination to prevent from both angles. So these are all technological advancements what they are doing.
So I think you have answered the nasal part. I think the follow-up question is on the oral. I think there is some studies still going on the oral vaccine also, right? So
I would like to put a word here for, since you brought the question of oral vaccine. Now we are using a drug called pidotimod, which is known to improve the innate system of the body. What it does is, it is a overall immunity booster. Let it be any virus, any bacteria, any cold, it improves our own innate immune system. Our innate immune system comprises of 5 components, and all these 5 components are stimulated and boosted by this drug called pidotimod. So we are using in most or all our COVID patients in the early part of the disease. We have to use this drug early part so that it boosts up our immune status and kills the virus. Once the first week is over, once the products of inflammation start coming, then this oral pidotimod will not work. I just wanted to share my views on this.
Sure, thank you. And I think the question is about when do we get the teenagers vaccine by June, so that their education is not impacted.
Sorry, when do we get for the teenagers?
Teenagers, is it possible by June?
Yeah, the earlier the 45 and above people take the vaccination and they get vaccinated, then the next phase will come. So I should think we should encourage more of people to go and take the vaccination, which definitely people have increased. Definitely the people waiting in the vaccine queues have increased. So the more number of people complete the vaccination in the 45 years and above age group, the earlier the youngsters will get the time.
Sure. And the question about the efficacy of the vaccine, is it something that is permanent, or do you have to do it like an annual flu shots?
I think this is going to take as an annual flu shot. Either it can be yearly or it can be even 6 monthly also. We don't know. Probably yearly. The work is going on where they are trying now to merge the influenza virus, like when they did when the swine flu epidemic came. The existing influenza virus with the swine flu subsequently, with this COVID virus subsequently. So I think we are going to need booster shot every year, as we have been doing for the influenza vaccination. It's not a one-time vaccination.
Okay. So I think there's a follow-up question by Dr. Rajaya. So he's asking that, you know, why I'm active and he's walking around 3,000 steps every day, driving his own car. Should I still be taking his vaccine?
I think, as I told you, sir, vaccine has to be taken by everybody. Though the first priority is elderly and those with comorbidities, but everybody. See, once we get infected and we go into complications, then we end up in all the complications of COVID. So I think everybody, whether your immunity is good or strong, is very nice that immunity is strong, but still you must take the vaccine to develop robust antibodies to prevent any future infection. So I think everybody should be getting vaccinated at the end of the day.
Sure. So I think would you be kind enough to share the precautions to be taken for having the fibrosis possibilities?
What I would like to say is, if somebody has developed a COVID infection, we check the blood parameters: CRP, LDH, ferritin, D-dimer, IL-6. Each has its own relevance. CRP, LDH, and ferritin are markers of inflammation. So once they are elevated, it means that inflammation is going on in the lung and in the other organs as well. So it has to be treated with anti-inflammatory, where we give steroids. Then we have the D-dimer. If D-dimer is elevated, it indicates that there is a likelihood of a clotting disorder occurring in this COVID patient. So we put them on oral anticoagulants. Then it is the IL-6, interleukin 6. Interleukin 6, if it is elevated, it indicates that we are going to have probably multi-organ involvement, other than the lungs also, kidney, heart, liver, etc. So these are the values on relevance of these investigations. With regard to pulmonary fibrosis, those patients who are having high level of inflammatory markers like CRP, especially ferritin, if their ferritin is high initially, this is a warning to us that this patient will recover from COVID maybe, but he is going to end up in post-COVID complications. So aggressively treat these patients with antivirals, steroids, anti-inflammatory drugs, and anticoagulants, and admit them in the hospital. That is the one thing I would like to say where you prevent post-COVID pulmonary fibrosis. Secondly, now there are certain drugs in the market like pirfenidone and nintedanib. Especially nintedanib, some trials are done now where if it is started early on itself, when we are doubting, yes, this patient is showing signs of fibrosis. How do you detect signs of fibrosis in a COVID patient? Say you are giving oxygen, 4 liters, 5 liters, 8 liters, still he is unable to raise his oxygen saturation. That means the lungs are slowly getting tightened up. So your oxygen, though you are increasing, it is not able to diffuse properly, and probably he is developing fibrosis. At that stage itself, if you start the nintedanib, not waiting till the end, and then probably we are recovering. We have seen many patients recovering from this with this drug. So I think the timing is important. Early recognition of the warning signs, aggressive treatment, early starting of nintedanib will prevent, and post recovery pulmonary rehabilitation, like breathing exercises, that also is showing a lot of important role in preventing the fibrosis.
Thank you. And one more policy question. And when do you reckon that schools are going to be reopened?
I think mostly they have reopened once and then they closed again. So I think another till September, October, I presume. That is, if this surge is able to be reduced, or if the patient is, population is developing herd immunity. Once 65% of the population are infected or vaccinated, then we are developed herd immunity. My gut feeling is it will be September, October, or maybe early November. It won't open before that. They may try to open it again for other reasons, political or government reasons, but again, they will have to shut down it.
Thank you. How long does it take to recover if one is infected within 15 days of taking the second dose?
Once you take a second dose, and after 2 weeks, once you develop a robust immunity, if you happen to get infected again, it will be very mild infection. Generally, we are seeing few patients now who have completed the vaccinations schedule, and few of them have got infected. My friends is as well, but they are having very mild infection or even asymptomatic infection. They recover within 10 days to 2 weeks, and they're becoming negative very fast. Even a few people have become negative on the day 6 or day 7 itself. So that's the advantage of being vaccinated.
I think you answered this question, but somebody has a question again. Why do you get fever on vaccination?
It's an important question because, see, as I told you, vaccination, we are, our aim is to develop a robust immunity or immune response. When our body is developing the immune cells, it is bound to react. For example, we get an injury, we feel the area become warm. If you feel slightly feverish, it goes away. It's like this. When the body is developing the immunity or immune cells, it reacts, producing with mild fever, headache, or some warmth feeling, which disappears in 48 hours. So actually, now they say people who have fever post vaccination, their immunity may be no, developing to a higher extent than compared to those who are not having high fever. If you see mostly elderly population or those with comorbidities, they are not having high fevers because their age itself is reducing what we called as immunosenescence. As we age, our immunity reduces. So their ability to produce antibodies is much less than a young person of 35 to 40 years.
And I'll just take a couple of last questions. So, how effective is HFNC compared to ventilators in treating most of the affected
See,
lungs?
as a critical care specialist, our choice is to avoid ventilation as much as possible in these patients, not only for the patient, but for the doctor's sake itself, because once you intubate him and the doctor is at a very high risk of getting infected. So we try, if a patient is not maintaining saturation, oxygen saturation with oxygen, plain oxygen itself, either with a nasal cannula or with a mask, first thing we try is NIV, that is non-invasive ventilation, which is a mask which delivers a pressure to keep the airways open. Now, people who are not tolerating NIV or those who are not responding to NIV, then we go for HFNC, that is high flow nasal cannula oxygen. And then most of them, they recover with this. We can go up to 60 liters as well. So only those patients who are not responding to HFNC or NIV, they are taken up for the ventilator. Okay, or unless they have a multi-organ involvement with reduction in blood pressure, sepsis, fungal infections. Very commonly we see fungal infections in these sick patients. So they are the patients who need to be intubated and mechanically ventilated. But as a doctor, our aim is always to avoid ventilation as much as possible.
Uh, uh, I think the question on the fever again, a follow-up question. Once you have the vaccine done and you have a fever, does it mean you're still, once you have a fever, does it mean you're still vulnerable and weak, or you're turned?
No, as I told you, after vaccination, if fever is a good sign. It means that your body is developing antibodies to of a substantial number and amount, so that it is manifesting as a fever, and then it disappears in 48 hours. I developed 103 fever after vaccination. After 48 hours, it was fine without any medication.
All right. I think that's it from